Hello my dear students, Assalamu alaikum. Hope you are fine. As per your request, today I will start the pericardium and the heart. As you know, the pericardium is the covering of the heart. We will start with the pericardium first. We will discuss about its organization, layers, arrangement, at the same time its blood supply, nerve supply, developmental sources, and the clinical importance as well. If you have any queries or questions regarding the presentation today, feel free to put your comment in the comment section below of the YouTube video where I will upload the video, at the same time in your discussion forum and also through the private messages. So let's start pericardium. Hello my student. So let's start heart with pericardium. I am Dr. Karim Rezwan Hasan, Associate Professor, Department of Anatomy. So first of all, let's see what is heart. Heart is a hollow muscular organ which is about the size of your fist. It weighs around 250 to 300 grams. An adult heart pumps about 7,500 liters of blood daily. It is responsible for pumping blood through the blood vessels by repeated rhythmic contractions. Now let's see some amazing facts about human heart. On an average, it beats 72 beats per minute, 4,200 beats per hour, about 1 lakh beats per day, 365 million beats per year, and about 30 billion beats in an average lifespan of 80 years person. It takes about only 20 seconds to pump blood to every cell of our body. Location of heart. We know that heart enclosed by the pericardium is located into the thoracic cavity. Actually, it is located in the middle mediastinum, where it is bounded anteriorly by the sternum, posteriorly by the thoracic vertebrae, on each side by the lung with their pleura, and inferiorly on the diaphragm. Over here we can see the heart with pericardium. On each side there are lungs, and it is sitting over the diaphragm. Now let's start the main topic of today's discussion, that is pericardium, which is the covering of the heart. So if you want to define pericardium, the definition would be like this. Pericardium is a double-layered fibroserous sac which encloses the heart and the root of the great vessels. It is located into the middle mediastinum, posterior to the body of the sternum and second to sixth costal cartilages, anterior to the middle four thoracic vertebra, that means thoracic 5 to thoracic 8. Now what are the layers of the pericardium? Pericardium has two layers. The superficial, that is called the fibrous pericardium, and the deep layer are actually having another two layers. The deep layer is the serous pericardium. It is having the outer parietal layer that lines the internal surface of the fibrous pericardium, and the visceral layer, which is also known as the epicardium, that lines the surface of the heart. These parietal and the visceral layers are separated by the pericardial cavity or the pericardial sac, and this sac or the cavity contains pericardial fluid. Now in this picture we can see the covering of the heart, that is the pericardium. Over here we can see that the pericardium is having the outer fibrous layer and inner serous layers, which are actually having parietal layer which is firmly adherent with the fibrous layer, and the visceral layer which is actually adhering on the surface of the heart. Over here it is very obvious that the parietal layer, which is actually firmly adherent with the fibrous layer, is folding on itself, and it is then covering the surface of the heart as the visceral layer. Then it is having the myocardium and the endocardium inside, which are the other layers of the heart. Now, what are the functions of the pericardium? Obviously, pericardium encloses heart, so it provides a protection. Then, pericardium is anchoring the heart with the surrounding structures like diaphragm and also with the sternum by the sternopericardial ligaments. As a covering, it is also preventing the overfilling of the heart with blood. That means it is preventing the over distension or expansion of the heart. Then it allows for the heart to work in a relatively friction-free environment. Obviously, heart is constantly dilating and constricting, so it needs a very smooth surface to do its functions. And pericardium, by the help of the pericardial cavity containing the pericardial fluid, allowing the friction-free environment, so the heart can move very smoothly. Now let's start with the outermost layer, the fibrous pericardium. The fibrous pericardium is strong fibrous sac which supports the heart and the root of the great vessels and firmly adherent with the parietal layer of the serous pericardium. It is having an apex and a base just because it is conical in shape. The apex is blunt and fused with the outer coat of the root of the great vessels, like ascending aorta and the pulmonary trunk. On the other hand, the base is broad and blended with the central tendon of the diaphragm. We will see a picture. Anteriorly, it is connected to the posterior aspect of the body of the sternum by superior and inferior sternopericardial ligaments, just what I said before. Posteriorly, it is related to the principal bronchi, esophagus and the descending thoracic aorta. Laterally, it is related to the phrenic nerves and the pericardiophrenik vessels. Let's see a diagram. Over here, the green colored area is the fibrous pericardium. The above we can see the conical shape. This portion is called the apex, which is actually enclosing the root of the great vessels. On the other hand, this wide area is the base, which is actually located on the superior surface of the diaphragm. Over here we can see the outline of the sternum, and these two things are the sternopericardial ligament through which the pericardium is attached with the sternum. On each side we can see the pulmonary vessels. Now this is the actual picture of the pericardium. Over here we can see the outermost layer, which seems very fibrous, and this is the fibrous pericardium. Here the fibrous pericardium is peeled up. Now what about the serous pericardium? The serous pericardium lines the fibrous pericardium at its inner aspect, and also it lines the heart. It is divided into the parietal and the visceral layer. The parietal layer lines the fibrous pericardium and is reflected around the root of the great vessels to become continuous with the visceral layer of the serous pericardium that closely covers the heart. On the other hand, the visceral pericardium firmly attached to the surface of the heart except along the cardiac groove or sulcuses, where it is separated from the heart by the coronary vessels. We know that visceral pericardium is firmly adherent over the surface of the heart, but in some places it is not possible to touch the heart directly because those spaces are mainly the cardiac groove or sulcus, and those spaces are actually containing structures like coronary vessels and also the cardiac veins. So in those areas the visceral pericardium is actually going over those vessels, and that's why the visceral pericardium are not in touch with the heart itself. Over here we can see, after removing the fibrous pericardium, over here this is the serous pericardium, which is actually the visceral layer of the serous pericardium. We can see, and some of the fatty deposition into the heart. Actually, this is the actual heart, and over here we can see that the pericardial sac is exposed totally, because this shiny area is nothing but the parietal layer, and over the heart there is the visceral layer. So in between these two layers, the sac which was present over here, that is the pericardial sac or the pericardial cavity. So the pericardial cavity is a slit-like space between the parietal and the visceral layer. Normally the cavity contains a small amount of tissue fluid, which is about 50 ml, called the pericardial fluid, which acts as a lubricant to facilitate the movements of the heart. Again a picture, the fibrous pericardium. After removal of the fibrous pericardium, we can see the inner aspect of the fibrous pericardium, which is quite shiny, and this is the parietal pericardium. On the surface of the heart, whatever we can see, this is the visceral pericardium or the epicardium, and obviously when you remove the parietal layer along with the fibrous layer and we expose the visceral pericardium, so in between these two layers, the space which was present over here, that space is called the pericardial cavity or the pericardial sac. Now, very important topic is the pericardial sinuses. What are these pericardial sinuses? The sinuses are the potential spaces within the pericardium that are formed between the parietal and the visceral layer of the serous pericardium. So the sinuses has to be present in between the parietal and the visceral layer. There are two types of pericardial sinuses. One is transverse sinus, another one is oblique sinus. They are created because of the reflection of the visceral layer of serous pericardium around the great vessels as a consequence of folding of the primitive heart tube to accommodate within the pericardial sac during its development. To make it simple, let's think about the heart is developing into a pericardial sac. So that primitive heart, which was actually tubular in shape initially, has to be molded on itself to get accommodate within that pericardial sac. And when this heart is accommodating within the pericardial sac with some folding, this pericardial sac is forming the sinuses, that is the transverse sinus and the oblique sinus, and that sinus is actually forming in between the parietal and the visceral layer. So let's talk about the transverse pericardial sinuses, which is formed as a result of the embryological folding of the heart. The transverse pericardial sinus is a passage through the pericardial cavity. The transverse sinus separates the heart arterial tube from the venous tube. That means this sinus is present in between the arterial tube and the venous tube. The arterial tube includes the aorta and the pulmonary trunk, where the venous tubes are the vena cava and the pulmonary veins, especially the superior vena cava. So if you want to locate it, it has to be posterior to the ascending aorta and the pulmonary trunk, and it should be anterior to the superior vena cava, and superiorly this transverse sinus is having the left atrium. Let's see. Over here we can see the actually standard demonstration how you can trace the transverse sinus. Here the person is inserting his index finger into the transverse sinus, where we can see anterior to the sinus, that is the ascending aorta and the pulmonary trunk, and posteriorly we can see the superior vena cava over here. This is the diagrammatical representation of the transverse sinus. Now this transverse sinus actually, now the oblique pericardial sinuses. It is a recess of serous pericardium supporting the base of the heart, actually the left atrium. It is enclosed by the J-shaped sheath of visceral layer of the serous pericardium, enclosing 6 veins, under which there are 2 vena cava, that means superior inferior vena cava, and the 4 pulmonary veins on each side. The oblique sinus develops as an effect of gradual absorption of the 4 pulmonary veins into the left atrium during the time of development. Actually, oblique sinus develops when there was absorption of the pulmonary veins into the wall of the left atrium. For your kind information, left atrium is formed mainly by the absorption of the four pulmonary vein, and when it was happening, that sac, J-shaped sac like sheath of visceral pericardium is producing the oblique sinus over there. So obviously this oblique sinus is present posterior to the left atrium. The oblique sinus permits the distension of the left atrium during return of oxygenated blood from the lung into the heart. We know that. Here we can see the person is placing his hand behind the heart, that means behind the base of the heart. The base of the heart is mainly formed by the left atrium. So the person is placing his hand behind the left atrium, and that space where the person is placing his hand is nothing but the oblique sinus. So if you remove the heart, then we can see this space over here, which is actually the oblique sinus, and we can see it is present in between the superior inferior vena cava and the right side, the right pulmonary veins, on the left side the left pulmonary veins. Inferiorly it is free. Now what is the boundary of the oblique sinus? Oblique sinus is bounded anteriorly by the left atrium, posteriorly by the parietal pericardium, on right side by the reflection of the visceral pericardium along with the right pulmonary veins and the inferior vena cava, on the left side by the reflection of the visceral pericardium along with the left pulmonary veins, and superiorly by the reflection of the visceral pericardium along the left and the right superior pulmonary veins, and inferiorly it is open. So again we can see a picture of the oblique sinus over here, and this is the transverse sinus and this one is the oblique sinus. Now let's talk about the arterial supply of the pericardium. Fibrous and the parietal layer gets its artery supply mainly from a slender branch of internal thoracic artery named pericardiophrenik artery. Actually, pericardiophrenik artery is giving the main arterial supply to the fibrous and the parietal layer, and this artery is often accompanied by the phrenic nerve to the diaphragm. Some of the smaller contribution of the blood is also coming from the musculophrenic artery, which is one of the terminal branches of the internal thoracic artery, and some of the branches are coming from the bronchial, esophageal, superior phrenic artery, and also from the descending thoracic aorta. On the other hand, the visceral layer of the serous pericardium gets its artery supply from the coronary arteries, that are the branches of the ascending aorta. We know that the coronary arteries is the artery supply of the heart. So the visceral pericardium, being adherent with the heart itself, is having the same artery supply, that is the coronary artery. Now venous drainage of the pericardium. Again, the fibrous and the parietal pericardium is getting its venous drainage from the pericardiophrenik vein, that are the tributaries of the brachiocephalic vein, or it can come from the internal thoracic vein, and some of the tributaries are also coming from the azygous venous system. On the other hand, the visceral pericardium gets its venous drainage through the cardiac veins. As we know, the heart is also getting its venous drainage by the different cardiac veins, like the great cardiac veins, middle cardiac vein, small cardiac veins, and the vena cordis minimi. Now what about the nerve supply of the pericardium? The fibrous and the parietal layer of the serous pericardium are supplied by the phrenic nerve. The root value is cervical 3 to cervical 5. That is originate into the neck region and travel down into the thoracic cavity to supply the pericardium and also the diaphragm. The phrenic means diaphragm, so phrenic nerve is also supplying the diaphragm. Phrenic nerve is providing the somatic innervation to the pericardium, and that's why it is pain sensitive. On the other hand, the visceral layer of the serous pericardium has autonomic innervation just like the heart. The branches of the sympathetic trunk are coming from the thoracic 2 to thoracic 5 segment of the spinal cord. On the other hand, the parasympathetic nerve is coming from the vagus nerve. Now in this picture we can see the phrenic nerve is coming from the neck region and it is traveling down to the thoracic cage along with the pericardiophrenik vessels. In this picture we can see The phrenic nerve is coming from the cervical 3, 4 and 5 segment of the spinal cord, and they are going into the pericardium on the either side and giving the branches over here. Now a short description of the development of the pericardium. Only the sources of development, because we will learn the developmental process later on in details. But the fibrous pericardium is developing from the septum transversum, which is a mesodermal partition which is happening into the developing embryo to separate the thoracic cavity from the abdominal cavity. The parietal pericardium is coming from the somatopleuric layer of lateral plate mesoderm. The visceral pericardium is coming from the splanchnopleurotic layer of lateral plate mesoderm. That's all from the gross anatomy portion regarding the pericardium. Now we will learn some applied anatomy of the pericardium. That means the clinical correlations of the pericardium. First of all, let us know the surgical importance of transverse sinus. During the cardiac surgery, the pericardial sac is opened by putting a finger through the transverse sinus, as we have seen before. And obviously, posterior to the aorta and the pulmonary trunk, you have to put your finger. A temporary ligature is passed through this transverse sinus and around the aorta and the pulmonary trunk to ligate them during coronary artery bypass grafting to avoid bleeding. Same thing is happening during the introduction of the tubes of the heart-lung machine into the great vessels. The same procedure is done to ligate these vessels and tighten up them, especially during the heart transplantation. Whatever cardiac surgery we can do, we need to arrest the excessive bleeding, and that's why we need to block the great vessels, and that's why we need to ligate them. And to ligate them, the transverse sinus is a good passage to pass the ligature sutures or the ligature material. Now pericarditis. Pericarditis is simply defined as the inflammation of the pericardium. Its origin can be infectious, it can be immunological, metabolic, neoplastic, traumatic, or from the myocardial infarction. Pericarditis often produces pleuritic pain in the center of the chest that radiates to the neck or the back region and varies with the deep breathing. It increases upon the lying flat and relieved by the sitting upright. The condition is usually short-lived and is treated with anti-inflammatory pain mediators, medications, and colchicines. Constrictive pericarditis occurs when long-term inflammation of the pericardium causes thickening, scarring, and often calcified pericardium. That means your pericardium will be very much thickened, and sometimes it can be calcified. This abnormal thickening of the pericardium compresses the heart and resulting impairment of its function by limiting the diastolic filling of the ventricles. Obviously, when the pericardium becomes non-elastic and very much thick, then the heart cannot move properly, and when it needs to dilate, it will not have sufficient space and it will compress the heart, and this is called the constrictive pericarditis, which is a common complication from the acute pericarditis. Over here we can see the normal pericardium, and over here we can see the pericardium is inflamed and it is that much thickened. Even in the X-ray we can see the outline of the pericardium, the white color line we can see over here, a faint white color line. That means the pericardium is too much thick and even calcified. Some of the clinical correlations that I have discussed a little earlier, like inflamed pericardium, that is a friction rub, that is a special sound during the auscultation through the stethoscope, and the pain will increase when the person is lying flat, and it will be relieved when the person is sitting. There are some ECG changes over here. The cause can be viral, neoplastic, uremic, and the connective tissue disorders that I have told. And the treatment is mainly the non-steroidal anti-inflammatory drug, sometimes colchicine, and also we can use a steroid to relieve the complications. Pericardial effusions. Normally pericardial cavity contains a thin film of pericardial fluid which is about 50 ml that prevents frictions between the parietal and the visceral pericardium during heart movements. If there is excessive accumulation of fluid within pericardial cavity, that is called the pericardial effusion. It may occur due to the pericarditis following heart surgery, some of the autoimmune disorder like the rheumatoid arthritis, and sometimes the metastasis, that is the spreading of the carcinoma. That carcinoma may come from the lung cancer, breast cancer, melanoma, that is the skin cancer, leukemia, non-Hodgkin's lymphoma, and Hodgkin's disease. In this picture we can see the normal heart and a heart with pericardial fluid, excessive pericardial fluid, that is the pericardial effusion. We can see how this excessive fluid is compressing the heart. In the chest X-ray, the heart shows increased in diameter and appears as globular shape or the bag shape. We can see the outline of the heart is quite big, even it is touching the thoracic cage. The diameter is more than the half of the total diameter of the thoracic cage. Obviously, the heart is very much enlarged. Now the cardiac tamponade. Pericardial effusion or sometimes bleeding into the pericardium due to any injury can limit the space available for the expansion of the heart. If this is severe enough to limit the venous return, then cardiac output falls drastically as a result of the heart being not able to fill with blood, and this condition is called the cardiac tamponade. That means when excessive pericardial effusion happens, it will compress over the heart and the heart will not have sufficient expansion to have the venous return, and when the venous return is limited, obviously the cardiac output will be also less, and this is called the cardiac tamponade. Cardiac tamponade is a life-threatening condition and often requires urgent attention, especially the medical attention. The treatment consists of drainage of the pericardial fluid by using a needle immediately, and obviously placement a catheter in the pericardium for continuous drainage, or surgical creation of a window between the pericardial and the pleural spaces. That means we cannot allow the pericardium to have excessive fluid within the pericardial sac. That's all about the cardiac tamponade. So my dear student, this is the last slide of today's presentation. Hopefully in the coming days we will continue the heart presentation. If you have any queries regarding what we have discussed today, please feel free to ask the questions in the comment section of the YouTube or in your teaching study group, and also through the private messages. I'll be very happy to help you out. Take care, be safe, and thank you for your patience hearing.